Hello, I'm Dr. Marilyn Franklin. Today we are learning medical terminology the easy way. You may have already viewed my lesson 3. You know that it was an impactful lesson in which we learned at least 250 medical terms. Today you have the ability to learn 160 more, which is going to make a total of 400 at least. So you may be thinking that doesn't sound that easy, but just hang on, you'll see what I mean. Today we're going to learn 8 root words, 7 suffixes, and 8 prefixes for a total of, how many is that? 23 elements, I believe it is. And these 23 elements can be combined in different ways to make at least 150 terms, just on the basis of what we're learning today. You can add these new terms to the ones you learned in the previous lesson for over 400 terms, as I mentioned. So I wanted to show you this little diagram to show you that your prefixes, suffixes, and root words are sort of like little cards or little puzzle pieces that can be interchanged with each other, and they retain their meaning every time they are placed with a new element, and it just makes it really handy to learn in this way. In the gold, you're going to see the prefixes. In the white are the root words. I've changed it from blue to white. In the magenta color, you've got the suffixes. So for most of those prefixes, if you were going to add a prefix to one of the root words, you'd probably need to put AL, excuse me, or some other AAC, for example, other suffix that means pertaining to make a complete word. So let's get started. Today we have the 8 new root words. We have chondro, which means cartilage. We have esophago, meaning the esophagus. If you know what the esophagus is, then you're saying thank you, because esophago is just esophagus with an O on the end of it. Myo means muscle. Pulmo or pulmono, both of those mean lung. Spleno and leno mean the spleen. Again, spleno, spleen, easy, huh? The next one, tracheo. If you know the trachea is the air tube, then tracheo is a really easy one to learn. Uretero and urethro round out the 8. So we're going to look at uretero and urethro and find out what the difference is in those, because they look kind of similar, don't they? In the little diagram, you see the kidneys above. The tubes leading from the kidneys to the urinary bladder are called ureters. Some people call them ureters, and that is just fine. They lead to the urinary bladder, and then there's a single tube coming from the bladder called the urethra. Okay? So I don't know how to tell you how to remember one from the other. It's just one of those things that you need to learn, but it's really important that you know the difference. Okay? So on the next slide, I have a note of caution. I have urethra, ureter, and then I threw in uterus for good measure. We've already studied those. Urethra leads from the bladder to the outside of the body. Ureter from the kidneys to the bladder. And then you know the uterus is the womb. It's where the fetus develops. And the reason I put that in there is that I have had students who actually got that confused, believe it or not. So you don't want to do that. Look at the 2 adjectives on the box below. We have ureteral and urethral. Okay, make sure that you can form the adjectives correctly as well. So today's new suffixes, we have synthesis. Synthesis means a puncture of. That may sound like a bad thing, but if you think about it, you have to puncture structures at times. There are biopsies that are done by puncture. Every time you have blood drawn, that's a puncture. Perhaps you have too much fluid on your knee and they remove fluid from that area. That's called a synthesis as well. So synthesis is puncture. Genesis means to form. Lith and lithiasis, that has to do with stones, such as kidney stones and gallstones. Lith itself means stone. Lithiasis means condition in which there is a stone or more stones, more than one stone. The next one is lysis. Lysis means to destroy. The next one is plasty, which means to repair. If you have a nose job, that's called rhinoplasty, for example. The next one is raphy or Rafi, a little hard to pronounce unless it's placed with a root word. That means to suture. And finally, there's stomy. We oftentimes call that an ostomy. The O is usually contributed by the root word, but at any rate, a stomy or ostomy is an opening. You may have heard of a colostomy. It's an opening that is surgically performed. It is either a permanent or a semi-permanent opening of a structure into another area. So we're going to treat the prefixes a little bit later. I wanted to go ahead and look at esophagus or esophago and place it with some new suffixes and some old suffixes, and we'll see how that goes. We have esophagocentesis, which would be a puncture of the esophagus. We have esophagoplasty, surgical repair of the esophagus. Esophagogenesis, to form the esophagus, in the embryo perhaps. Esophagolysis or esophagolysis would be dissolution or destruction of the esophagus. And finally, esophagoraphy would be suturing of the esophagus. So those are some of our new suffixes to go with esophagus. Let's look at some old suffixes to go with esophagus. We have esophagotomy. Remember, T-O-M means to cut. Esophagotomy would be to cut into the esophagus. Esophagoplasia would be growth of the esophagus. Esophagology is a tongue twister. That would be study of the esophagus. Esophagomegaly would be enlargement of the esophagus. And esophagopathy would be disease of the esophagus. I just thought of something. You may have heard the word megalith. That would be a large stone, or I keep going back to lith, don't I? Megabytes or megawatts. You know that mega means large. So you can remember megaly in that way. But so anyway, we had esophagomegaly at that juncture, and then we had esophagopathy. On the next slides, I have made a good many medical terms that are built on chondro for cartilage. In fact, I took as many of our suffixes as would fit and made medical terms from the root word chondro and the suffix. So examples are study of cartilage, esophagology. One who studies cartilage, esophagologist. Disease of cartilage, chondropathy. And enlargement of cartilage, chondromegaly. I think I went back to esophagus for a moment. I'm really prone to doing that. But we're talking about cartilage or chondro right now. So on the next page then, these are medical terms that have to do with cartilage. Notice all but about four of them have an asterisk beside them. Those are words that are made by dropping the O. The rest of them are made with the O. You remember the rule for that, I'm sure. Keep the O if the suffix begins with a consonant. Drop the O if it begins with a vowel. So again, we have chondrology, chondrologist, chondropathy, chondromegaly. Those are the ones we mentioned on the prior slide. Look at the next one. Chondroscopy would be to place an instrument into cartilage and to inspect it. Chondrocyte would be a cartilage cell. The next one, chondroplasia, would be cartilage growth. There's a term called achondroplasia, which means without cartilage growth. That's the literal meaning. The actual meaning, there's a type of dwarfism that is called achondroplasia, in which there's a deficiency of cartilage growth. We have chondrogram, which would be an image of cartilage. Chondrography, which would be to obtain that image of cartilage. Chondrotomy would be to cut into cartilage. Chondrectomy, to remove cartilage. Furthermore, chondritis would be inflammation of cartilage. See what we've done? We've taken that root word, cartilage, chondro, we've placed it with all these suffixes. So I'll let you go ahead and read the rest of them by yourselves. On the next two slides, I have 4 different root words that are placed with with the same suffixes to show you how the terms are made. This is almost overkill for most of you at this point, but it again demonstrates the rule of dropping the O if your suffix begins with a vowel. The thing is, you've not seen that many of them, and I wanted you to be able to see some examples. So let's go. Actually, before we go to that next slide, the fourth word down says, let's see, tracheectomy. We've got two E's together. It looks like it would be tracheectomy, doesn't it? But it's tracheectomy. There are certain times when two vowels that are the same are permitted, and that's one of those times. It wouldn't be tracheectomy, but tracheectomy. So here we are forming terms correctly. The ones with trachea were on the previous slide. Look at the ones with the spleen. Splenogenesis would be formation of the spleen. Splenocyte, a spleen cell. Splenotomy, to cut into the spleen. Splenectomy, to remove the spleen. Splenitis, inflammation of the spleen. Splenalgia would be spleen pain, pain coming from the spleen. So again, we had maybe 5 or 6 that the O is dropped, and for the rest of them, the O has remained. Notice that when you do that, look at the last word on the slide, splenalgia. When you drop that O, the first letter of that suffix beginning in a vowel just remains the same. So algia means pain, splenalgia means spleen pain. Here are others. We have ureterogenesis, ureterocyte, ureterotomy, ureterectomy, ureteritis, ureteralgia. All of those same suffixes with the word ureter. By the way, the word ureter can be pronounced ureter. If it is in a compound term, like a medical term, you usually do pronounce it ureter. So it could be ureteralgia, but it makes it a little difficult to say. Finally, we have myo for muscle, myogenesis meaning muscle formation, myocyte, muscle cell, myotomy, to cut into a muscle, myectomy, to remove muscle or part of a muscle. The next one is where I wanted to go with this, myositis. It's not myoitis or myitis, it is myositis. Not sure why. I have to look that up and get back to you. Then finally we have myalgia. You may have heard of fibromyalgia, very painful muscle condition. So on the next slide, we see that now we're moving into our prefixes. Without a whole lot of additional effort today, you can learn several more words by learning these prefixes. We're going to inspect the prefixes. I have them written in alphabetical order, even though some of them appear to be out of place in a way. Extra means located outside of. So you could have an extrahepatic pain. That would be pain coming from somewhere other than the liver. Hyper means excessive, such as hypertension. Hypo means lower than normal or a deficiency of, so you could have hypotension. You could have hypoglycemia, which means that your blood sugar is below normal. The next one is infra. Infra and hypo can mean the same things in certain conditions, but infra means located below. So you could have an infradiaphragmatic abscess, an abscess below your diaphragm. The word inter means between. Inter means between, so interstate commerce would be trade between the states. International commerce, trade between the nations. And an intercostal muscle would be a muscle between the ribs. Finally, we have retro. Retro means behind. And we could have a retrosternal abscess, which would be an abscess behind the breastbone. You could have retrocardiac pain. You could have renal abscess behind the kidneys. Retro is a very commonly used prefix. Finally, we have supra, meaning located above. So now I've placed the prefixes with the different root words, and you'll notice many of the root words have a suffix now that ends in AC or AL, meaning making them adjectives. So if you look at the first one, supracardiac means located above the heart. It wouldn't be supracardio, but supracardiac. Infradermal meaning below the dermis, the skin. Extrarenal meaning something located outside the kidneys. Intrahepatic would be something within the liver. Interpulmonic would be between the two lungs, inter. Retrocardiac would be behind the heart. Hypoglycemia would be, as I said, lower than normal blood pressure, blood sugar. Hypoglossal would be below the tongue. Hypotension would be abnormally low blood pressure. Hypertension, abnormally high blood pressure. Okay. So on the next slide, we have taken the word renal, which has to do with kidneys, and we've put 7 of the 8 prefixes with them just to show you how versatile these prefixes are. 7 out of 8 will go with renal to form valid medical terms. Suprarenal, infrarenal, etc. Incidentally, the word suprarenal, which means above the kidney, that word is a word for the adrenal glands. You may have heard of the adrenal glands. They produce cortisol. Another word for them is the suprarenal glands. I think in England they actually call the adrenal glands the suprarenal glands. So you can keep going. You can see we have interrenal, which would be between the kidneys, retrorenal behind the kidneys, hyporenal or infrarenal below the kidneys. So you'll notice this slide presentation or this lesson is a little shorter than the other one. You'll also know that some of the work actually is going to be done on your own, of course, but I always like to put at the end some of these opportunities to fill in the blanks with medical terms. So we're looking at chart entries. The first one says, ultrasound of the gallbladder and liver demonstrate gallbladder inflammation. So you're supposed to supply a word meaning gallbladder inflammation. Cholecysto is gallbladder. Inflammation is itis. That would be cholecystitis. That's one we've had already. It showed dilation of the common bile duct and no definite stones identified. Okay. However, X-ray of the gallbladder, called cholecystogram, did demonstrate the presence of stones, meaning cholecystolithiasis, gallbladder stones. The patient is scheduled for surgery, gallbladder removal. In a few days, gallbladder removal would be cholecystectomy. Okay? So you notice if you know cholecyst, you can put a lot of suffixes with cholecyst and make some good words as well. On the next page, we see a patient has had esophagogastroduodenoscopy. Thank goodness we abbreviated EGD. And on EGD examination, the patient was shown to have inflammation of the esophagus, which would be esophagitis. The patient had inflammation of the stomach, gastritis. The patient had mild paralysis of the stomach wall, which is called gastroparesis. Paresis meaning paralysis. Okay. The person had increased blood vessel formation in the esophagus, which, believe it or not, indicates liver disease, and the word for liver disease would be hepatopathy. Okay? In the next one, it says that this patient had removal of the spleen a year ago and removal of the kidney 5 years ago. The spleen removal was splenectomy. The kidney removal was nephrectomy. And then 1 year ago, the patient had a kidney infection or nephritis, and they had inflammation of their veins, which is phlebitis, right? So nephritis and phlebitis. The fourth one on that page says cervical spine x-rays demonstrate normal intervertebral alignment. Intervertebral means between the vertebrae. There is a congenital lack of formation of this little bitty finger-like bone called the odontoid process, and that lack of formation is agenesis. you know that if you put a with the word, it means without. So agenesis, without formation. The fifth one says the patient was diagnosed with a torn lateral meniscus cartilage on the left. You probably know that a meniscus cartilage is in the knee. The tear was repaired at arthroscopy, which means insertion of a lighted instrument into the joint, and by cartilage suturing, and that word would be chondrography. Okay. In the next one, the patient has a large mass in the left upper quadrant, very laterally, and they have attendant spleen enlargement. That would be splenomegaly. They're scheduled for surgery to have the spleen removed. That would be splenectomy. Okay, so splenomegaly, splenectomy. Finally, number 7 says this patient has an obstruction of the upper airway. They're going to have an incision into their trachea, which is a tracheotomy, and a tube is going to be placed and another little sleeve type of apparatus. And this is going to make it into a semi-permanent, hopefully semi-permanent opening called a tracheostomy. And this is, like I said, hopefully going to be there just long enough for the blockage to be removed and perhaps healing to occur, and then they will reestablish the normal airway breathing at that point. But that's a tracheostomy. Again, you may remember what a colostomy is, in which a tube or an opening is made into the colon to allow a distal part of the colon to heal, or in some cases to allow the colon to evacuate into a bag worn onto the abdominal wall. On the next couple of pages, we have the answers to the medical terms to fill in all of those blanks: cholecystitis, cholecystogram, etc. So at this point, I have to say congratulations. You've managed to watch another lesson, the 4th lesson in medical terminology the easy way. You have a little bit of work to do, but basically you probably know 33 to 35% of these terms already. Perhaps you know even more from listening today. But what if you don't? What if you didn't know any of these and you didn't know esophagus was the food tube and all of that? It doesn't matter, okay, because you're learning that now. But I want you to use every crutch you can think of to remember these terms. I think supra is easy. If something is suprarenal, it means it's superior to the kidneys. And if someone acts superior to you, they act like they're above you. So above is supra. Retro, think of people who have retro taste in furniture and that sort of thing. Retro means behind. Esophago, easy to see how that would be a real easy one to learn. Same thing for spleno. Look at lysis. You know that Lysol is a product that's used to kill germs, destroy germs, and lysis means to destroy. So that's an easy one. Think about Genesis, which is the opposite of lysis. Genesis is the first book of the Bible, and in that book, it is told how the earth and all of its inhabitants are formed. So formation is Genesis. Inter, again, think of interstate commerce. Extra, I've put a little thing on the slide that is not really funny, but it says, think of an extramarital affair. Don't have one, just think of one. Okay. That means outside the marriage, right? So extra is outside. So make up mnemonics, rhymes, little sentences, however you can do it. You can learn a group of related terms and put them in alphabetical order. Sometimes that helps you to learn them. But the point is, use all of your faculties to learn these entities. Before long, you're going to know them like the back of your hand, and you'll no longer need those. So take a minute to catch your breath, okay? We will be doing some good reviewing next time. We'll probably just add a few suffixes, because I think you've seen the power of knowing suffixes to expanding your medical terminology prowess. So again, next time we're going to do a whole lot of reviewing. Tell your friends and classmates about these lessons. I'd like for them to join in and let them know that it's not so hard to learn 400 medical terms in 2 lessons, and you're doing it the easy way. So until next time, bye.